Health information, health informatics, and coding professionals do not work in a vacuum. The good news is we work in offices at desks, which means we can rely on resources to make sure we are always doing an accurate, 100% good job. Let's talk about what we can use. The benefits of using your resources is nobody's memory, well, except Sheldon from The Big Bang Theory and that guy Spencer Reid from Criminal Minds. They're the only two people that have eidetic memories. So, except for them, the rest of us really, when we don't have to, should not rely on our memories because they're not necessarily perfect. And so, therefore, you will decrease the opportunity for making a mistake or assuming something you should not. This also gives you an opportunity to learn new things instead of guessing, which is totally illegal, and it will increase your future job options because the more you know, the more you can do. Books you can use, obviously your coding manuals, ICD-10-CM, CPT, HCPCS Level 2, and ICD-10-PCS if you're working in a hospital. But also important is to have a medical dictionary. Now, I know people laugh at me when I say having a paper medical dictionary. I like it because I can just reach for it as soon as I find a word I don't understand or I'm not 100% sure that I understand. Okay? But if you want to use a computerized one, use like Medline Plus, which is an online medical dictionary from the National Institutes of Health. Okay, just don't believe everything you read on the internet, which you already know that. The other reason I always suggest a medical dictionary in paper is you can bring these with you to the certification exams, but also you may be working in a program at work that will not allow you to access the internet, to make sure that everything is kept secure. So be a little old-fashioned. You can buy one on Amazon.com for like $10. Okay. A physician's desk reference, also known as a physician's digital reference, lists all of the drugs. We're going to talk about this in more detail in a minute. But this is the Bible of all drugs and herbal remedies. And then the Merck manual is also a good idea. Okay, let's talk about the diagnosis codes. You are learning, or you have learned, that diagnosis codes explain why the patient required procedure services and also explains medical necessity for hospital admissions and as well as long-term care and nursing home, etc., and what the medical necessity was for providing this patient with care. All the guidelines are right in front of the book of the ICD-10-CM manual, so all you have to do is remember to refer to them. And again, this is all the way, there are many ways that the code books actually help you to do an accurate job, and all you have to do is read it. Why wouldn't you do that? Okay, CPT, current procedural terminology, procedure codes for physician services, as well as outpatient procedures. The guidelines here are located in front of each of the sections within CPT, as well as within each section. When there are guidelines appropriate to just one group of codes, the guidelines will be right there. And again, all you have to do is read them. And then you'll be the most wonderful, perfect coder ever. Okay, HCPCS Level 2, HCPCS Level 2. These are codes for ancillary services. They code for durable medical equipment, professionally administered drugs. They are mandated to be used by Medicare as well as some private insurers. You'll need to find out once you're on the job. The medical dictionary, as I said, remember that you work in a hospital or even a physician's office or any kind of facility, and there are going to be firewalls and other virus protections that may prevent you from getting on the internet. So I do recommend an old-fashioned paper medical dictionary so you have it at hand, literally at hand, so you can ensure that you understand the words that you are reading. Okay? It'll also provide you with synonyms in case the term that the physician uses in the documentation is not the same term used by the code set, which can happen. The physician's desk reference, or physician's digital reference, is a directory of all drugs and medications, including over-the-counter medications and herbal remedies, in addition to pharmaceuticals that require a prescription. This gives you lots of very important information for coding and reporting poisonings as well as adverse effects. The Merck manual contains very important data on not only the causes of certain illnesses and conditions, but it will include signs and symptoms. And this will enable you to differentiate an inclusive sign and symptom from one that has nothing to do with this particular condition. It'll also explain the medical necessity for diagnostic testing and treatments, because remember, it is up to the coders to connect all the dots, the why with the what, and we have to make sure that a diagnostic test or a treatment is according to the standard of care. We're not questioning the physician's judgment. We just may need an additional diagnosis documented or something like that. Okay, yes, there are internet sources for your learning. These are only some of them. And you want to make certain, first of all, that if you're using a resource, you know for an absolute fact that this is a credible resource. There are a lot of people out there trying to sell things that skew factual information. Well, you already know this, okay? Just because it's on the internet does not mean you can trust it. So, as you go along, you can build or ask your instructor about what are good internet resources that are credible for different types of healthcare information that you may need to know. There are publications, yes, printed on paper. They do exist in addition to digitally. The American Hospital Association Coding Clinic for ICD-10 CMPCS, the CPT Assistant, the Journal of American Medical Association, the New England Journal of Medicine, the Journal of AHIMA, and Healthcare Business from AAPC, as well as others. There are local associations, regional, state, national associations. AHIMA has national, state, and local chapters or components. AAPC has national and local. There are chat rooms within the communities of practice and the AHIMA website. Networking is very important, not only for your career, but for your knowledge. Okay, so do yourself a favor and become familiar with many of these resources, because they will help you do your job better, both while you are in school as well as when you are on the job. And who wants to take a work, get a degree, work toward a career, get into that career, and not do the absolute best job possible? It doesn't make any sense. Okay, you can do this. If you have any questions, ask your instructor or post to the Q&A with a professor discussion forum.